Hi, my name is Sean Gupta. I work as a physiotherapist and own my own private practice clinic in Winnipeg, Canada. Now, you probably stumbled across this website because you've been suffering with persistent foot and ankle pain and it's affecting your day-to-day living and you're not able to go back to enjoy the things that you like to do, such as exercising, running, or even just regular day-to-day things. I'd like to tell you something, that there are some simple, effective, and practical things that you could do right now to start treating that foot pain of yours. The information that I'm about to give you is very valuable, and I hope that you would at least find one or two practical things that you could implement right away to start alleviating that foot and ankle pain. So before I tell you the first tip to start treating that foot and ankle pain, I'd like to take some time to tell you three other pieces of valuable information. The first one is that the information that I'm about to provide for you is the same information and the same high quality education that I normally would be providing to a patient that sought treatment at my clinic. So in other words, you're going to be getting it for free. The second thing is that some of you may also have concurrent knee pain while you're having foot pain as well. If you implement some of these tips, it's possible that the knee pain may actually become less as well. So in other words, the foot could be causing some of your knee pain, and by implementing some of these strategies, you may also notice less knee pain. The third thing, and I think it's probably the most important, is that the education that I'm about to provide for you is mainly intended for those of you that have basic foot pain. So those of you that have maybe heel pain, Achilles pain, plantar fascia pain, any pain in the arch or pain caused by bunions, you may find this information quite valuable. Now, for those of you that have a serious disease such as rheumatoid arthritis, peripheral vascular disease, or even diabetes, perhaps your foot pain may be related to that condition. And I would highly suggest you consult a qualified medical health professional to determine the exact cause of your pain so you can get the specific treatment. You may also find some of the education beneficial, but I would also recommend that you see someone before implementing these strategies. Here's the first tip on starting to treat that foot and ankle pain of yours, and that is you need to make sure you find the proper shoe. Now, for some of you, you may have the proper shoe and you know that, but for others, you have no idea whether the shoe you have is the right one for you. You know, the topic of footwear is very vast and it's too extensive for this short video. So what I've decided to do is I made another video which I'll provide for you at the end of this one, and you could visit that website to gain more information on choosing the proper shoe for you. Some of you may have already seen that video, and I hope you were able to implement some of those techniques and strategies to determine the proper shoe for you. So how do you know if you have the proper footwear? Well, if you went into a store, purchased the shoes at a store where they didn't ask you any questions about your pain, didn't take a look at your arch, or didn't even watch the way you walk, it's probably a safe bet that you didn't get the right shoe and that person was not qualified at all. You know, finding a shoe is very important because shoes are made with a specific sport and activity in mind. So if you're a runner, then you should get a running shoe. If you like to play a wide variety of sports, then perhaps a cross trainer would be more appropriate for you. Shoes are not only made with a specific sport and activity in mind, they're also made with a specific type of foot in mind. So for those of you that have a low arched foot, then you need a specific shoe that has built-in arch support to stabilize that foot better. Others of you have a normal arch foot, and you could do really well with a normal shoe that has some arch support and a little bit of cushioning. And those of you that have an excessively high arched foot, it's quite possible you're going to need a shoe with a lot of cushioning. Again, if you just visit my website on choosing a proper shoe, I'll give you a video there and you could be better informed on how to choose the right shoe for you. Now, there are some stores in my local area that I am aware of that have proper shoes, and their staff are properly trained at determining what shoe is the most beneficial for you. Three stores come to mind right now. One of them is called Stride Ahead in Grant Park Shopping Mall. Another one is Running Room. They have 3 locations in Winnipeg. And another one, which many of you may be familiar with, is Canadian Footwear. They also have 3 stores in Winnipeg. The staff at these stores are very well trained, and they'll be able to answer any questions on pain and also guide you on the appropriate shoe for you to start alleviating that foot pain. For some of you that don't know if your store nearby has properly trained staff, I would recommend that you call the store, speak to the manager, and ask them if their staff has any training on fitting customers for the proper shoe. If anybody knows any reputable stores in the Winnipeg area that I failed to mention, why don't you just send me a comment at the bottom of this video, and I'll make sure to include it in my next and upcoming videos. The next thing that you need to do once you have the proper shoe, or perhaps you've already had it this whole time, is you need to wear the shoe anytime you're going to be on your feet. Now, if you're going to be standing for any prolonged time, go for a walk, go to the shopping mall, it's really important that you put your shoe on because your foot needs the necessary support and cushion in order for it to get better. Now, some of you might be thinking, well, I don't want to wear an athletic shoe all the time. It maybe doesn't match my wardrobe, or it's not conducive to my environment. Well, I'll let you know that they also sell some shoes that are all black or all white leather, and so it can match your wardrobe. And these shoes also have the specific support and cushion that is necessary for your foot. So I understand that for some of you, wearing the shoe all the time is not appropriate, and you don't want to be wearing an athletic shoe. So I know that Canadian Footwear actually sells casual shoes, non-athletic shoes, that have built-in arch supports and cushion. One shoe that comes to my mind is the Dunham brand. They have a particular advanced technology where they put in a built-in arch support. So sometimes that shoe might be appropriate for you. Again, if anyone knows any other shoes out there that are non-athletic and casual that have built-in arch supports and motion control shoes, let me know and I'll include it in my next video. The next tip is pretty valuable for those of you that are suffering with plantar fascia pain, especially those of you that have pain upon rising first thing in the morning and taking your first step. If you do some foot and ankle exercises prior to rising and prior to bearing weight through your feet when you wake up in the morning, you might find your foot pain is significantly less. And when I say foot and ankle exercises, I'm talking about something simple like pumping your ankle up and down, all the way up, 15 or 20 times. What that will do is it will loosen up the tissue so that the first step that you take in the morning is not as painful. Also, if you notice that you have pain upon rising when you've been sitting for a long period of time, you may find these foot and ankle exercises quite beneficial. If any of you do find it quite helpful, I would suggest you incorporate it throughout your day, maybe performing that exercise every 1 or 2 hours, especially when you've been sitting or lying down for a long period of time. Also, if you're rising first thing in the morning, after having done these foot and ankle exercises, I would suggest you put your shoes on before taking a step. These two things might be all that's necessary for you to start having relief from your foot pain that you have first thing in the morning. Okay, so I'm going to show you how to tie your shoelaces up a different way. And this way is mainly used for runners or for those of you that feel that your foot is slipping inside your shoe. This technique here requires you to actually take the first shoelace out of the hole. Okay, so normally this is how your shoelaces might be configured. Take the first one out. Take the second one out of the opposite side. Now, instead of lacing that lace back into the opposite side, put it into the same side. Okay, and then similarly, take the other one and put it into the same side as well. Okay? What you do then is take this one here and loop it through the hole that you've just created on the right side. Similarly, put the other one through the hole that you've created on the left side. And what you'll find is when you pull on them, right, you get this kind of configuration. Okay, what this does is the angle of the pull of when you tie your shoe changes so that it actually cinches up this portion and might have the ability to control the heel a little bit better. For some of you that feel like the foot is slipping around or moving around in there, this technique works really well to hold that foot more snugly and prevent excessive motion.